All right, so for this session, we're going to be going over nose, mouth, and oral pharynx. The first thing I'm going to do is observe her nose, having her sit comfortably with the back chair. So when I'm looking at her nose, I'm looking for any deviation or asymmetry, looking for any mucus leaking or anything abnormal. Once I do that, I'm then going to have her put her one finger on one side of her nose and breathe for me, and then repeat on the opposite side. Just checking to see if there's any asymmetry with the breathing, which could lead to something like septal deviation. Next, actually, I'm then going to go palpate her sinuses. So for this, I'm going to go for the maxillary sinuses. So first, I'm going to just palpate your face in two spots. First on your cheek, and then on her forehead for her frontal. Then I'm going to give a light percussion on both. Any pain with that?
Nope.
Both felt normal to me. Next, I'm now going to actually look inside of her nose, looking for any abnormalities with the turbinates or any seen any deviated septum, redness, anything just out of the abnormal. So for that, I'm just going to have you tilt your head back just a little bit slightly for me. Turn the light on my scope. Tilt your head back for me. I'm then going to put my hand on your forehead, my fingers on your forehead, with my thumb pulling back your nose a little bit, just to open it up more for me. All right. I'm going to have you breathe in and hold it just for a second for me. Good. Okay. And then take a breath. All right. Now have you hold your breath again for me one more time. And good. Saw nothing out of the ordinary. It was a little bit red, which could indicate that possibly getting over a cold or have some sort of viral issue, but nothing out of the abnormal that would cause concern. Okay, so next I'm going to look at her mouth. For that, I'm going to need my tongue depressor and a light. First, I'm going to observe her lips. When I'm looking at her lips, I'm just going to see if there's correct pigmentation, no fissuring, cracking, any sores of the sort. First, I'm going to start with open your mouth slightly for me and pull back her lower lip just to look at her gum and her teeth. Look for coloration, normal colored gums such as like pink and such. And then I will now have you open your mouth again. Now I'm going to look at above at the gum line, looking at just her normal, just for normal structures, making sure that nothing out of the abnormal. And have you open your mouth wide for me. And then I'm going to come looking inside. This I'm going to observe the salivary ducts and parotid ducts. Just look for any abnormality, any chew or bite marks that may occur from bad habit, which I do not see. I do not see a line of aspera or anything of the sort. I also then look at the other side. While doing this, I can also look at the roof of her mouth just to see if there's any bony abnormality, which I do actually notice a small torus palentinus right here. All right. I would also look at the dorsum of her tongue just to make sure there isn't any sort of inflammation or discoloration that would cause for concern. Have you opened her mouth for again? Sorry. When doing this, I'm also going to look under her tongue, just look at the frenulum, see the normal size frenulum, and look at the bottom, just to see if there's any bony displacement like in the top, which I do not see any, which is good. The next, I'm going to observe her her tonsils. So for this, I'm going to have you stick your tongue out for me. Open your mouth wide and go ah. Tonsils look normal with no abnormal swelling or redness. The next thing I'm going to do is check her gag reflex. This is going to observe cranial nerve 9 and 10. For this, I'm going to look for symmetrical rising and falling. Okay, for this, I'm just going to have you put your tongue out as far as you can for me, and then I'm going to activate your gag reflex. It's going to cause some discomfort. Okay, yeah. So we had normal rising of the tonsils. Last thing I'm going to have her do with her mouth is I'm going to have her stick her tongue out for me. Perfect. That shows me that there's no lesions with the tongue or cranial nerve 12, which would cause, if there was a lesion, possibly deviation to the left or right. And for that, that is the end of mouth.